you and welcome back to Girl Talk with Dr. King. Today I have Mrs. Tiffany James, and I don't know if you all met her before, but she is an administrator. She's an ex-principal. She works with kids all day and every day. And today we're here to discuss birth control, which has been such a big hot topic because now we have politics trying to tell us about our bodies. So tell me, what are some of the experiences that you have or that you see in the schools regarding birth control?
So it's really interesting. We've talked before about how young people now are kind of coming into their own and having, especially young ladies, a bit more ownership over their sexuality. But there's still that stigma attached where, everything is on the girl.
Yeah.
And so what they're having difficulty doing, and why I'm so glad that we are connecting and able to work together, is finding out how to navigate getting consistent birth control, maybe when their parents aren't feeling like they're ready to have that.
Yeah.
So, there are always things that you can get over the counter, but sometimes young ladies are looking for something else.
Yeah.
And that's a really difficult space for them to navigate. They don't know if they should go to their primary care physician. They don't know if they should try to seek out an OBGYN.
Yeah.
Middle school girls, young high school girls don't always have an OBGYN yet. So it's really difficult.
I'm glad you brought that up. I don't think that people know when you see an OBGYN, you're emancipated, meaning I can talk to you and I don't have to say anything to your mother about that. So typically when I see teens in my office, I will say, Mom, I'm going to have you stay for the history because you may know some things that your daughter doesn't. I'm going to have you step out. I tell them up front because I don't want them to feel like I'm trying to be sneaky. So I say, Mom, okay, now's the time. I'm going to have you step out. We're going to bring you back in because we're going to discuss X, Y, and Z. Then I feel like I can have a confidential, real conversation. And I tell the patient, whatever you share with me, I can't share with your mom or dad, even if you're on their insurance. So don't think that patients know that, and they need to know that. A separate thing is I think that patients believe that Planned Parenthood, all they do is abortions, which is not true. They do so much more for preventative care. They do birth control counseling. They give birth control. They do pap smears. They do all these things. And so if they feel like they don't have a regular OBGYN or they don't feel comfortable going to their pediatrician, they can go to Planned Parenthood. So that's a resource that I think you can use in your schools too.
No, that's so helpful. I don't think that students know that at all. And I also think that there's kind of, again, this stigma around anything dealing with sexuality. And so even if they are able to have birth control, there's follow-up that needs to happen after that. As a person who has a couple more years on her, I know that it's not a one and done situation.
Sure.
And it might not, some young ladies don't react well to it. There might be some weight gain or so. And so they want to kind of try to tailor it to make it fit their lifestyle. And it's something that has to be consistent.
Yeah.
And people have such a hard time with consistency for most things. So it's really difficult for them to navigate alone. They really do need that guidance.
And I think the onus is on the provider as well. When I see young people, I make it seem like this is probably the first and last time I'll see them. I'm hopeful that they will come back. So I give them all the goods up front. I want them to follow up in 3 months. And now, because we have telehealth, I make it easier for them. Just call me. Let's just have a telehealth appointment. You don't have to physically come in, but I need to check in with you to make sure that it's working. And the reason I do that is that not just young people, all people. If you have a side effect that you're not comfortable with, you're going to stop it and not even go back to it. And then they'll come back, and they'll come back pregnant. So I tell them, you may have irregular bleeding, which is a really number one side effect for a lot of birth controls. And we can talk about them individually, but for universal, you're going to have some irregular bleeding. And I love the patients who say, well, hey, I took the pill for 30 days and I bled a whole lot. I was like, oh, okay. And I'm not surprised. And they look at me like I should be surprised. I was like, no, I told you that. Did you stop it? Yeah, and then I bled all the time. So we need to do better in the office and maximize your time you have with these people to say, that could be a side effect. Weight gain could be a side effect. Not having periods could be a side effect, all these things. And if we don't address it up front, I may not see them later. So,
And that's so true. And I'm so glad you said that, because then they're looking for the more permanent or long-term solution. So I've had girls say, I've heard these conversations, well, I want to get an IUD because once you have that, then everything's taken care of.
Yeah.
And then somebody said, oh no, but IUDs give you cancer. So
yeah.
a lot of misinformation
Right.
in the schoolhouse.
Yeah.
But looking for that permanent solution or feeling more permanent as a solution, because to remember a pill every day, to have the
Yes.
breakthrough bleeding, to be involved in sports and have your metabolism changing all the time. Some girls don't want that. They
Right.
want to know more about things that are more like the implants that I feel like we used to have years ago. Do you remember that?
You're dating yourself.
I'm very old. I keep telling you
You are
this.
not very old.
But do you remember they
Yes.
had the implants?
But I remember they used to look like an alien
Yes.
underneath
Yeah.
your skin.
Yeah.
Okay, so that was called the Norplant. We do not do that anymore.
Okay.
But we do have an implant. It's called the Nexplanon.
Okay.
It was called, okay. So
That sounds like an alien too, but okay.
but it's only one little rod. It's very discreet. It's for those people who want discretion. Okay. And it goes underneath the arm, and it's good for 3 years. It is progesterone only. And I say that because sometimes patients can't take estrogen, so they're looking for alternatives. The problem with the Nexplanon is that its bleeding is unpredictable. So a third of my patients have normal periods, they're fine, everything's great. A third of my patients have no periods, that's okay for them too. But a third of my patients have this irregular bleeding that they're like, can you take this out? Now, mind you, if I go through the process of getting it in, because we have like a tiny needle and underneath the skin, I want it to work. And I want it to stay for 3 years. So I also counsel them, do not panic if you have irregular bleeding for like 90 days. If they call me in 90 days and I see the bleeding is still kind of irregular, maybe give me another 90. But after 6 months, if it's not working, we'll find another option for you. But yes, it's the new version is called the Nexplanon.
Okay.
So that one's good. The pill, well, let me go back. I love when patients say, what's the best birth control out there?
Right. That's the conversation I hear.
At school?
Oh, the IUD. Nothing else will happen.
Right.
You get IUD, you won't get pregnant.
Right. So best is relative. I can tell you what's the most effective. The IUD is 99% effective, but so is the Nexplanon. If I don't have to rely on you to do anything about it, it's pretty effective.
Yeah, you're taking away that user error.
Yes. The user error, right? So that's amazing. But what's best for you is what's going to work for you, right? Meaning the pill, some people, I have older patients who have been on the pill for years and they say, it works for me. I haven't gotten pregnant in umpteen years. It's fine. So that's best for you. Okay. But I have patients who won't remember to take a pill every day. I have patients, and sometimes patients can't take estrogen, which we do have a progesterone only pill. However, it's not as effective. So for our young people, if it's not the same time of day every day, it's not great because they can get pregnant. We have the Nexplanon we already talked about. We have the shot, and the Depo-Provera shot.
Okay.
It is good for patients. They can just come in, get an injection every 3 months. It's progesterone only. However, the side effects are really high. So that's not my go-to. People who've been on it, I'll refill it for them because they obviously do fine. But you can have bone loss. You can have hair loss.
Oh, wow.
You can have weight gain. It's an appetite stimulant. So people be like, I've been on Depo, and because you get it for 3 months, I can't change it for you.
Right.
You know what I mean? It's not that quick and easy. Risk of getting, or not risk, but pregnancy, when you want to get pregnant, it takes a longer time. So again, it's not my go-to, but it's an option for patients who have done well. They have to take vitamin D and calcium because it does break down your bone. And then you mentioned one of my favorites, the IUD. There's 2 types though. Did you know that?
I did not know that.
So the intrauterine device, there's 2 types. Mirena is the one that has a hormone in it, and that's good for 5 years. Someone just told me the FDA has approved for 7 years.
Oh, wow.
And then it's the one that's copper, no hormone. So for patients who can't take any hormone, they have an option too, which I think is way important, right? And that one's good for 10 years. Okay. The IUD Mirena is unique because people who have abnormal bleeding, which means periods that are irregular or whatever, or have pelvic pain with their periods, they can get an IUD, and sometimes they don't have periods.
Oh,
So 99% effective. Take away my periods.
sounds good.
Sounds pretty good.
Yeah.
And then the copper IUD, sometimes your periods can get a little bit heavier. Now with the Mirena IUD, sometimes you can have a lot of bleeding in the beginning, cramping, discomfort. For young people, I have to really counsel them. Young people sometimes are not very comfortable with pelvic exams, and it goes through the pelvis, so it's inside of the uterus like a T, and so we counsel them. So when we talk about birth control, we can have that conversation because there's so many options. There are so many ways to not get pregnant. And of course, we always say, please use a condom no matter. Well, you're just about to say
I
that?
was just about to say. So because that's such a big deal.
Yeah.
Right? People are so concerned about that.
Yes.
And, our young people now are really thinking about their future.
Yeah.
And what do they want to do next? And all the time, having children earlier isn't really in the plan. But I feel like when you are comfortable with that long-term solution, okay, you
Yes.
have the shot or you got the implant or you got whatever it is, now you feel comfortable enough that maybe you're not using any other type of protection. And I know before when we talked about safe sex versus safer sex,
Yes,
then where are we on that continuum?
exactly. And the other thing that I think is important to have this conversation, because we're not going to go dig deep into politics, but we know that Roe versus Wade was overturned. And in some states, abortion services are not available. So if we do our due diligence and talking about birth control and preventing pregnancy to begin with, then we don't have to be super worried about our young people not being able to have access to care that they need. So that's my soapbox. We can have a different talk about that later, but I thank you so much for joining me about this fabulous conversation about contraception and protecting our young people and making sure that they are equipped with the armor they need. So thank you all for joining Girl Talk with Dr. King. Remember that you have options. There are so many ways to not get pregnant. You can look at your OBGYN or your primary care physician or Planned Parenthood. You need to understand that it is not only a place to have abortions. So thank you again, and I look forward to seeing you again with Girl Talk with Dr. King.